If you or someone you know has been diagnosed with a mental illness, whether it's a recent diagnosis or a long-standing one, you are going to be very eager to hear what Charles Miller has to say this morning. He is with Scenic Neurotherapy. Great to see you again.
Thanks for having us.
You and I were having a lovely conversation off camera. I almost wish we could have had a behind-the-scenes glimpse, because what you do at Scenic Neurotherapy is so interesting to me, Charles. First of all, it is not a one-size-fits-all approach, and it doesn't involve taking a pill.
Right, exactly. What we do is we work with the brain to stimulate a process called neurogenesis. Neurogenesis helps correct the physiology behind the communication issues in the brain, which account for a lot of the physiology behind our mood disorders that people suffer with.
So you are using in your practice right now ketamine, which I'm going to let you kind of remind our audience, because you have a lot of background as in the anesthesia world, correct?
Correct. I'm a certified registered nurse anesthesiologist. We work in every hospital administering anesthetics in Tennessee and most of the United States.
So ketamine, in the past, if not even currently, can be used as a pediatric anesthetic.
That's correct. It's approved for 6 months and older. It's the safest anesthetic that we have, and it is surprisingly the one anesthetic that stimulates this process the best.
So it does not mean that when you come to see them, they're going to anesthetize you. It is not that.
No, it's all very low dose. It's called sub-anesthetic dosing. And so what that means is we give you a very low dose, slowly infused over a period of time, so that all of our patients are aware and awake and can communicate the entire time.
What it's doing is a natural process, you were saying, that regenerates a protein.
That's correct. It's ketamine is just a catalyst. Other things can be used as a catalyst, transcranial magnetic stimulation, even the stellate ganglion block we see used with PTSD for veterans. Ketamine is actually the most effective means of stimulating this neuroregenerative process. It stimulates a protein release called brain-derived neurotrophic factor. This protein is neuroregenerative over a period of time, and it helps the brain to self-optimize. And when the brain's communicating effectively, the struggle with certain mood disorders and the overwhelming nature of anxiety is remarkably and quickly relieved.
So let's just set up a test scenario for a second, okay? Let's say that somebody comes in and it's a 34-year-old woman, and she's been struggling with an undiagnosed mental illness for a few years, and she's not sure if it's anxiety or depression or what have you. Before she comes to you, does she need to have a diagnosis, or do you just talk to the patient and figure out a treatment plan on your own?
We actually work with mental health providers all over the area. We have several psychiatrists, mental health nurse practitioners, psychologists that refer to us. We are not mental health providers, and we like to stay in our lane. We are anesthesia providers. We make sure that this is done effectively and safely and to the highest standard possible. That being said, we work closely with your provider if you already have one. If you don't, we will pair you with one, and they will help manage you from a mental health perspective to make sure we get best results.
So I set you up and you answered it perfectly, because you're not going to go rogue on people. You're not trying in any way to usurp a doctor's role. You're there to provide, as you said, that catalyst role to kind of speed up the process, if you will, to get them stabilized faster.
Absolutely. We work in Congress with them. We're just another tool in the tool belt of treating mental health. It's just one piece of the puzzle. If this were the only thing you needed, then it would be a magic fix, but it's not. I wish it were. But
you do see results for people pretty quickly. I mean, you mentioned these infusions that you get with the ketamine, and the process of it. How many infusions does a person typically receive, and over how long a period of time?
Well, almost every protocol from a mood disorder perspective involves a stabilization phase of 6 infusions of between 2 to 3 weeks.
Okay.
So that's about 2 infusions a week. And then after that, maintenance looks like whatever the patient needs it to be. Some people need it more frequent, but it's more like a safety net. It's more just to hold the patient at up here once we get them up here, while they're working with their counselor, while they're working with their mental health providers, while they're making life changes and identifying stressors in their day-to-day life that are modifiable.
So if they're currently on medication for their mood disorder, when they come to you and you're working in tandem with their doctor, are they going to abandon that medication, or will they continue to take it?
The medications take, if that is the end goal, is to discontinue them eventually, maybe we'll look at that. But the ketamine infusion and the way the medications work, they don't compete with each other. They actually work in tandem. in many ways. And so what we do is we work with their provider, and when the patient and their provider decide they're ready to wean those medications down, they can, but it wouldn't inhibit them from going forward with this process.
Is part of the win-win here, Charles, that the medications you say are not really intended to last permanently, and so people find themselves on this roller coaster of trying one and then another and then another? Does this help to minimize that?
One of the great frustrations I see with a lot of the psychiatrists and mental health providers out there is that they can only get so far with their patients, and because the medications help the patients reach a point of stabilization. But stabilization is not a permanent fix. Stabilization is just a temporary fix so the patient can start doing the work and moving themselves forward to a point to where the medications are less necessary. Problem is that we don't often see that. Most of the time people get to the point of stabilization, and then that's as far as we get. We're kind of the next step. We help them, work towards that goal of self-maintenance, and we help them get there quickly.
Is it true to say that the brain is sort of the last part of the body that we still really have a lot to learn about?
It's because everybody's brain's wired so differently. There's a lot of theoretical science involved in psychiatry and mental health. That being said, we know a lot as well. We're able to image living human brains for the first time, in our, history of medicine, and it has allowed us to have a greater understanding of how the brain communicates.
So things are evolving, and I think you told me that we once thought, once thought that the way to deal with the mood disorder was a chemical imbalance. You're saying now the understanding is it's more physiological.
It's a communication issue, and the chemicals play a role in that. And so the medications, they do their part, but they're limited in their efficacy. What we do is we stimulate neuronal regrowth and enhance the communication of the neurons themselves. And so the neurotransmitters, or the chemicals, upregulate to meet the need automatically.
When people come and talk to you in the office, I bet they have 3 pages worth of questions they hope to get answers on.
Each consultation lasts about an hour to an hour and a half.
Really?
They get my undivided attention for that period of time, and we shut everything down during that process. And it doesn't cost anything. We're big on education. Even if you don't end up coming to us and you end up going somewhere else later when you're ready, we want you to be able to be educated on this process and advocate for yourself.
Is there some type of a mindset that you have to have coming into it?
Not really.
No, it's going to work.
This is not something that the patient is doing. This is not, this is something that's happening to them. It's a physiologic response to an anesthetic. There's a lot of hype out there about psychedelic, experiences and such. A low-dose anesthetic, most anesthetics you get pretty quick and at higher doses, and so you go from awake to out pretty quickly. With this, you're kind of in a floaty state for about 40 minutes, and then it wears off rapidly, and then...
If you are a single person, can you drive yourself to the treatments, or do you have to
No, you have to have a driver to every single infusion, and we're pretty hard-nosed about that. But we make sure that even people that don't have the typical ride, a partner to come with them.
Yeah.
Have even taken Ubers and such. But
and how old do you have to be to do this?
We lean heavily into 18 and older.
Okay.
Only in cases of extreme crisis have we considered it younger than that. But even still, there takes a measure of objectivity to do this that really only comes with age.
Okay.
And we want them to be successful. That's really our biggest goal.
And over the course of those weeks, the 2 to 3 weeks, I'm guessing that you kind of know what you're watching for. So if somebody comes in, they've gone through a couple of treatments and they come back, if you're not seeing what you expected, do you tweak things?
The dose is ever titrating to make sure we get optimal effect.
What does that mean?
Meaning that we are increasing or decreasing the dose to fit the individual.
Okay.
Some people I look at and I have an idea about what their doses should be, but then they go through the process and I see that maybe it was too low, or maybe that was a little more than they needed, and so we can adjust it for their comfort and for success.
It is a fascinating conversation. You must go home at the end of your day every day and sit over the supper table and talk about what you saw that day.
It's, as far as what I do, I tell everybody I've got the coolest job. I get to take something chronic and make it not, and that's something that we take a lot of pride in. It's something we're very excited to do and be a part of, and give back to Chattanooga.
Well, you heard him say there's no charge. Just clear your afternoon or your morning, because you will be there for an hour to an hour and a half as he listens to your story. It's Scenic City Neurotherapy, their phone number and website there on your screen. Give them a call today, see about making that appointment and how these treatments can help you. Great to see you, Charles.
Thanks for having me.